Pelvic floor exercises are really important exercises to do when you're having gynae surgery. They're muscles that link from the pubic symphysis at the front of the pelvis towards the coccyx at the back of the pelvis, and they sit like a little hammock. They have the back passage going through the muscles, the vagina going through the muscles, and the water pipe going through the muscles. So they're supportive muscles. If you can learn to do this muscle work well prior to your surgery, then when you're asked to do it once the catheter is taken out after your surgery, you'll find it much easier to find those muscles and to engage them. So we need to work these muscles in 3 different ways. There's power, endurance, and timing. A power contraction. First of all, sit up nice and tall as if your mum would be proud of you. Then think about tightening around the back passage, then around the vagina, and drawing those muscles up and forward, and then relax. So we'll just talk through that again. So tightening around the back passage, lifting through the vagina, bringing those muscles up and forward, and then relax. When you're doing this muscle work, make sure that you're not gripping with your bottom muscles. No shoulders lifting, eyebrows lifting, toes raising, or any funny faces. So it should be a really private exercise and focus just on the pelvic floor muscles. We really want you to try and do 10 of these 3 times a day. The endurance muscles, this is about postural control, so this is a very gentle lift. So this time, just lift those muscles by a third. Then you're going to hold and breathe for 10 breathing cycles. So engage those muscles just gently by a third. Now hold and breathe, hold and breathe, hold and breathe. Keep them going, keep them going. Keep breathing and holding, breathe and hold, keep them going, and relax and let them go. And again with this one, we want you to do 10 of these, holding each one for 10 breathing cycles, 3 times a day. Then the knack. This is about using the muscle at the right time. So when you cough, sneeze, laugh, lift, really do anything that involves effort, we need the pelvic floor muscles to be working first. So it's pelvic floor lift, hold those muscles on, then do a cough, keep those muscles on, and then relax. So you're being very functional about how you use those muscles. We have a lot of information written in the resource list at the end of this presentation. We also have a video on our webpage which goes into pelvic floor muscle exercises in a little bit more detail. And there is a really good NHS endorsed app called Squeezy, which we would really recommend you watching or using, because it reminds you to do the muscle work regularly. Because actually once you got into the swing of doing the muscles, they're not difficult, but certainly remembering to do them regularly can be a bit tricky.